Our first guests are Melanie Kelly of Novant Health and Gwen Whitley of Lower Cape Fear Hospice. Well, welcome to the show today, guys. It's a pleasure to have you.
Thank you.
Thank you.
And I'm so excited to hear about the new palliative care program here at Novant Health. But first, I'd like to get to know each of you a little bit better. So, Melanie, let's start with you and tell me what your role is at Novant Health.
Sure. My role at Novant Health is a system role, and I'm responsible for palliative care services throughout our footprint. We've been primarily focused so far on our acute care facilities, and we're really excited to be here to talk about what that means at Brunswick. I have been with Novant Health since 2007, and before that have been working with hospice and palliative care in various forms for about 12 years.
Great. That's interesting. How about you, Gwen? What is it that you do?
I'm the Chief Operating Officer for Lower Cape Fear Hospice and Life Care Center. I have been there since 2008. I am responsible for the clinical initiatives and clinical programs that we sponsor here in Brunswick County and the 8 surrounding counties.
Have you always been in palliative or hospice care?
No, I have a rich background in home health and home care and about 4 years previous with hospice.
Great, great. How about you, Melanie? Have you done other nursing other than palliative care?
I initially started off my nursing career doing critical care work and then cardiac telemetry work before getting into hospice care.
Wow, great. I think hospice care is so interesting. I think it's so valuable. We're so lucky to have it here. So the purpose of our interview today is to learn more about palliative care. And so let's just be real basic. So tell me what palliative care is.
Sure. Palliative care is specialized medical care for people who are suffering from a serious or life-limiting illness. It is a specialized field of medicine that is recognized with board certification for physicians. We're really there to be an extra layer of support for patients who are going through complex illness. We specialize in symptom management for not only the symptoms that happen with serious illness, but also the symptoms that happen with treatments that go along with serious illness. And we bring in a whole interdisciplinary team, including chaplains, social workers, and just really give a holistic approach to our care. A lot of help with decision making, goals of care conversations as patients move through their journey.
Is it always related, now this is maybe a dumb question, but is it always related to cancer, or does it's related to all chronic diseases? Is that correct?
That would be correct. Any serious illness, there's no age limit that's too young, too old. It's really a service that reaches out to anyone with a serious illness. Now,
I understand that Novant Health and Lower Cape Fear Hospice will be partnering to provide this service at the hospital. Tell me more about that. How will that work?
Well, we're going to be working in partnership with Lower Cape Fear to provide services at Brunswick Medical Center, and we're looking to start services sometime this March. And there's 2 wonderful providers who will be providing services that I'll let Gwen tell a little bit more about their background.
Right. Dr. Rebecca Summerlin is here in Brunswick County. She is board certified in hospice and palliative medicine, which has become very much a rarity. There's only about 1,800 board certified physicians in the nation. So Brunswick County is very fortunate to have Dr. Summerlin to have those credentials. She will be working very closely with Ann Weatherford, who is a nurse practitioner that is employed by Lower Cape Fear Hospice. And Ann is also certified through a hospice palliative network for advanced care practice nurse practitioners in hospice and palliative care. So it's really a great opportunity for us to have these specialists here in Brunswick County and to be able to partner with Novant to offer this wonderful service to the residents of Brunswick County.
I will say that I personally know Dr. Sutherland, and she's amazing. We absolutely love her. She's been
great
in the area for a long time, and lots of folks know her. So that's a great resource for us. And so you say the services will start in March. Explain to me how this type of care differs from the care that you would receive at Lower Cape Fear Hospice or in a patient's home. How would the palliative care here be different in the hospital?
Well, we provide, as you just mentioned, we provide hospice and palliative care to patients in their home. Those are patients that are not in an acute care setting that have the same needs that a patient would in the hospital. Help with pain and symptom management, goals of care discussion, advanced directives. We talk about advanced directives, and it's amazing that the large majority of patients and people do not have advanced care directives, so that's an important function of our palliative care team. On the outpatient side, it's that continuum of care so that the patient has that palliative care service in their home to be able to hopefully help them remain in their home and prevent the readmissions to the hospital. When patients go into the hospital, most patients go in very unexpected. Unless it's for a scheduled surgery or procedure, most of hospital stays are very acute, short settings in the hospital. So the patients still have the same needs in the hospital. This is a resource that we're partnering with Novant that they can do those referrals, and we can have either Dr. Summerlin or Ann Weatherford be there in the hospital that day to see the patient, to address those things that they are experts in addressing with caring for those patients and those special needs.
It sounds like we need more education about this in our communities and what have you, because I think there are some misconceptions about hospice as well as palliative care. Is there anything you can think of, Melanie, that you might want the community members to know or to hear to maybe make it easier for them?
I think for palliative care that it's really for any illness at any stage. It does not need to be end stage or at end of life. I think that's a big misconception that folks think that palliative care is just for the very end of life. It can really be given across the continuum, and as the disease progresses, usually our services will get more involved, and then there is the transition to hospice, who can continue that continuation of care in the home and provide wonderful services.
Yeah, I think when people hear the word hospice, they get scared. And palliative, they might not recognize, but I think through education, we can make this resource available to lots more people.
So many people think of hospice as giving up, and our philosophy is that it's about the quality, and every moment matters, and we want every moment to be as enjoyable and comfortable for the patient that they can be. One of the main differences that I try to explain to people with hospice and palliative care is that for palliative care, you can go full speed ahead with any type of treatment or interventions from your medical staff. It could be a cancer patient that wants to continue chemotherapy. It may be a cardiac patient that decides that they want to have open heart surgery, and that is fine.
Or a renal patient on dialysis.
Exactly.
Wow.
So they are able to tap into this wide variety of services and care while still being able to go with any aggressive treatment that they choose.
Well, that's great information. I'm really excited. I think it's a great bonus for the folks who live here in Brunswick County. I think it's wonderful. So it's been a pleasure to have you here today. I look forward to hearing more about the program as it grows. So thanks again for being here.
Thank you.